I'll get better at it. You're always good to go. We are live. What happened to Nicole? Hi, Nicole. I know you've been searching for me, and I was gonna make it today. I didn't make it TikTok, but I'm on there live. And there's already 8 people. Hey guys, just so you know, I didn't make an announcement. We are on live. We're on my YouTube channel with Parham, Dr.B Addiction Recovery. You can go on there and ask any questions you like. The topic today is going to be the root causes of addiction. This is a topic that is near and dear to both me and Parham. We're both pretty well versed on it. He's much better versed than I am, I'm sure, as a therapist. So thanks for coming on. And here we go. Remember, go to the channel. Hi, Nicole. Hi, Parham. How are you?
What's up, Doc? What's up, everyone? Really happy to be here, especially talking on this topic, which is the root causes of addiction. So I know a lot of people have been watching us in recent weeks, and they come on and they share about their struggles with various substances, whether it's benzos or opiates or alcohol, and talking or methamphetamines, and talking about their challenges they're going through. But we haven't really taken any time to dive into the root causes of addiction. And that's kind of what our intention is for today. And I'm really looking forward to it. Real quick, Miss Underwood, you're 22 days clean today, it says on the side. And I remember when you were 15-day clean last week. So it's been 7 days. Congratulations on that. Everyone else on the side chat, really appreciate your interaction. So
yeah, likewise. Likewise. I'm sorry. I've had both to TikTok folks and YouTube Monday. I'm gonna really get things moving again. Both with my stimulant series. There should be a few coming out. I promise you, we're gonna have 3 a week. TikTok, we're gonna be on schedule, putting stuff out. Me and Parham are getting some things planned for possible very, very sustainable seminars for you guys. Just really based on that are really gonna be useful. And one more announcement, I'll make a couple of them. We are gonna change the time for the show in the near future, and that's it. And hi guys on YouTube, John Boy, thank you so much. Yeah, 7 months clean after 20 years. Hell yeah, that's good stuff. Let's get started. Parham, we are talking today about the root causes of addiction, and in fact, one of our awesome supporters who is has become a friend of mine in Ohio. Send an email asking, hey, how come you guys never talk about this? And in fact, we are both all about this. It's just you got to deal with the upfront stuff first. So I'm going to let you generate the discussion and go at it. This is an awesome topic.
You got it, man. I really look forward to this. I'm going to do my best to kind of go 5 minutes straight here and just kind of share my thoughts on the topic of the root causes of addiction. Okay, so when you look at addiction, a lot of people want to just look up a general kind of a definition of it. And one of the accepted definitions, kind of is the continued use of a drink or a drug or a behavior despite of negative consequences. So the question there arises, why would somebody continue using a drug, continue consuming a drink, continuing with a behavior despite of negative consequences? Well, because what it is that they're getting out of it is worth it to them. So my friends, it is impossible to understand addictions without first finding out what it is the addict finds or hopes to find from the drink, the drug, or the addictive behavior. And that comes directly from a man named Gabor Mate. It's someone that I really respect and value his words. So again, I'll say that again. It is impossible to understand addictions without first finding out what it is the addict finds or hopes to find from the drink, the drug, the addictive behavior. So that's why people continue using despite of negative consequences. And when you kind of dive deep, and I've done so many biopsych socials myself, I've done so many assessments, I've looked at so many human beings' life over the course of their lifespan. I mean, from the time they're born into this world to the time they sit in a chair across me and Dr. B and they say, hey, doc, I'm struggling with addictions. Hey, Parham, I'm struggling with addictions. I've listened to their story. And one of the most common things that I've seen, a common theme that I've seen, is there are a lot of experiences of adverse childhood experiences. I'll tell you guys what they are, and trauma throughout their lifespan, right? A lot of trauma. And, some people, they minimize that and say, well, everybody experiences trauma. No, they don't. Okay, not everybody experiences trauma. In the world of addictions, and maybe the people that we associate with and hang out with, maybe in those worlds, a lot of people experience trauma. But the general population, it's not something that is as common as we think. In the addictions world, it's very, very, very common. So I want to tell you guys about adverse childhood experiences, because I believe that it is not professional or even, the right way to talk about addictions without talking about adverse childhood experiences. And here it is, as quick as I can.
Take your time, because this is important. I want everyone to really understand this, Parham, please.
Yeah, absolutely, man. So one of the outcomes of adverse childhood experiences is addictions. Okay, just one of the outcomes. And I'll share about the other ones also in a moment. But what happened is in the year 1995, this doctor named Vincent Folletti, he was working for Kaiser. And prior to that, he had his own obesity clinic, right? So obesity, people are coming in, they're overweight, they're having cardiovascular problems, they're having problems related to their heart, their health, their overall quality of life. And they're coming in, and he was trying to help them lose weight and get back to higher quality life. However, he kept facing challenges and challenges and challenges. They weren't following through with the treatment plan, despite of their life being dependent on it. They weren't able to go through and follow the recommendations, the guidance, the suggestions. And he started to wonder why. Why is this happening? And then he started to do a background history of all of the patients that were coming in. And he created this questionnaire that covers adverse childhood experiences. So on this questionnaire, my friends, here's what's on there. It is physical abuse. This is ages of 0 to 18. Physical abuse, emotional abuse, sexual abuse. Those are the three forms of abuse that are outlined on it from the ages 0 to 18. And then it has household stuff. So did you ever witness your mother being physically abused by a father or a boyfriend of the mother, and really actually seeing your mom go through abuse? The next one is, did you ever have a parent that was incarcerated? Did you ever have a parent that had substance abuse or mental health issues, right? Did you ever have early separation, divorce, or death in the family? And then later on, they added emotional neglect and physical neglect, because trauma, by the way, I want you guys to hear this. Trauma isn't always things that happen that shouldn't happen. Sometimes trauma is things that should happen that never did happen. Okay. So they started to kind of go through these adverse childhood experiences. And by the way, this study was completed on 17,000 people. Okay, between the years of 1995 and 1997. This wasn't a small study. And they had them answer this questionnaire, and they went through. And, by the way, a lot of people on the side chat, I'm just kind of paying attention. They're all saying, I check all the above, tick all the boxes. And this is very, very common. People that struggle with addictions, my friends, 4 and above is something that you see very, very commonly. So remember I said one of the outcomes of adverse childhood experiences is addictions. So I'll tell you guys this. And here's why this happens. So if somebody experiences adverse childhood experiences as a child, what that does is it causes emotional, psychological, and social impairments. If you're being abused at home and you're going to school, you're unable to focus. You're unable to engage and socialize. You're unable to be present, right? So it causes emotional, social, cognitive impairments at a young age. Now, what does that do later on in life? It causes maladaptive ways of coping and adjusting to those. So maybe a person starts using substances. Maybe a person starts using food as their drug. Maybe a person starts dating multiple people. Maybe a person starts getting caught up with the law because of those impairments. Now, if you're using substances and behaviors that have negative consequences, well, you're going to start having addiction problems. You're going to start having legal problems. You're going to start having health problems. You're going to start having a multitude of different problems, which ultimately leads to early death. Okay. And I'll tell you guys this. I have this stat I want to share with you real quick. Somebody that has 0 adverse childhood experiences, and this is directly from the CDC website of adverse childhood experiences. So someone that has 0 adverse childhood experiences versus someone that has 4. So with arthritis, with 4 of them versus 0, you have a 236% greater chance. Asthma, 231% greater chance. Cancer, 157% greater chance. COPD, 400% greater chance. Diabetes, 200% greater chance. Heart attack, 232% greater chance. Heart disease, 285% greater chance. Kidney disease, 263% greater chance. And stroke, 281% greater chance. And we're here for addictions. And I'll tell you guys this. This is probably the most profound stat that the adverse childhood experience has found. 0 versus 4, 500% greater chance of adult alcoholism. 0 versus 6, 2,600, that's 26-fold. And doctor knows how big deal 26-fold is in research. 2,600% greater chance of intravenous drug use. So that's 0 versus 6. And this is directly from the Adverse Childhood Experiences study. Feel free to look it up. It's wonderful. So I do believe personally, and again, this is not just based on this study. I've sat with people just like you that are experiencing addiction problems. And when you start sharing your life story, all of a sudden there are certain themes, and I bet doctor is going to be able to second some of this stuff based on his personal and professional experience that are very common in the world of addictions. And that's why doctor and I are both very rooted in compassion, because I believe that in order to deal with trauma and people's traumas, the therapeutic space must be rooted in compassion. The principal's office version of dealing with human beings has never worked, even when we were in elementary school, and it will not work even as grown adults that are struggling with addiction. So I'll continue talking about that later. And the one thing I do want people to know is this isn't to put blame or to put fault on the environment, right? Because here's the thing, man. Oftentimes this is multi-generational, right? It's multi-generational. The environment gets passed down, and sometimes people really don't know what to do. But when it gets to you, this is what I believe in, man. This is where cycles are meant to be broken. And the last quote I have here says, "We may not be responsible for the world that created our mind, but we may take responsibility for the mind that creates our world." And that's what we're all about, man. Helping people take responsibility for their mind that's creating their world today. So that's my root cause of addiction in a nutshell, Doc.
That's great. And I can only just add to that. And I'm going to be a little long-winded here, but everything you said is on the money. All I'm going to do is add to it. So in terms of substance abuse and as a clinician, as a medical doctor, people think I just prescribe meds. And if one was to look at closely at what I do and what each one of my organizations do, everything with the concepts of harm reduction, chronic care model is based on everything you just talked about. Unfortunately, given the social constructs that are present today, the resources aren't there to address this issue. ACEs, whatever you want to call them. This is truly a public health crisis, okay? Early social detriments of health, root cause of many devastating health and social challenges that face the individual in the future. And it goes, like you said, far beyond substance abuse. It just happens to be the one area that I'm most actively involved in, but I'm involved in other areas as well, including rehabilitation after coming out of prison, at-risk youth, and so forth. But, this is medical and behavioral problems, some of them including suicide, like we said, substance abuse, heart disease, diabetes, chronic lung disease, and there's long-term changes to your body. These are long-term biological changes that are secondary to the immediate stress response system of that child. Okay, it's called toxic stress response. And that's actually a term, and it's rooted in adverse childhood events and impacts long-term and short-term outcomes for that child, okay? There was a 2019, 18, I don't know, whatever, consensus report by the National Academy of Sciences, and they put a real impetus on healthcare workers to address this issue with early intervention. And in fact, many states now, including California, for the Medi-Cal recipient, a screening is not imposed, but rewarded by clinicians to be able to try to address this on the big picture. And you need trauma-informed approach and care, whatever you do. I'll give you another number. 8 out of 10 leading causes of death in the U.S. Have their roots implicated in ACE. And I want to say one thing, and we need early detection, education, and intervention. You mentioned abuse. You mentioned social. What did you mentioned the abuse part? You did them all, right? You also
the household factors, so the environmental factors,
right? Okay,
and then later on they added neglect in there too,
right? So neglect and childhood dysfunction, and I want to say something about that. Most people, it's obvious and easy to understand some kid being abused in different ways physically. It's the two of the things that are difficult, I think, and need a lot of education for a public that's uninformed, is one, the opposite side of the coin, which you pointed out, neglect. They added that later, but again, with each individual, it's a degree of sophistication and edification of the caretakers involved that is lacking, okay? And childhood dysfunction. I think a lot of what I have seen, people don't even know what is childhood dysfunction. 2, this stuff, the ACE screening might not even catch it because this stuff goes back to when you're 6 months, 3 months, 2 months old, even before birth, right? Yeah, your full focus should be on that child, whatever stage of development they are, and whether it's just holding them and providing that security, or when they start to reach 2 years of age, where in the classical psychoanalytic positions is when they start to form the self, okay? So understanding the science of ACE and toxic stress and how it can manifest in the body is absolutely critical for treatment and planning and long-term stuff, whether it's a kid or somebody older. This stuff is strongly associated in a dose-response fashion. So, if, for those of you that don't know what dose response is, cigarettes, okay? The more I have, the more likelihood I have of lung cancer, okay? That's a dose response. ACE works exactly the same way, okay? It's a dose response fashion, okay? And some of the most serious and costly health conditions facing our society today, okay, including 9 out of 10 leading causes of death in the United States and early mortality, has at its roots toxic stress, okay? And that same scientific body has shown that high doses of cumulative toxic stress during critical and sensitive times of early childhood development. And again, people don't understand that 1-year-old, that 2-year-old is included in this, guys, because if you speak to some people, those first 3 years, you miss it, you're screwed. Okay, I'd like to think we have more room than that because these kids are so resilient and adaptive. But if you miss it, those are all extremely stressful and critical, not stressful, critical and imperative developmental stages that can never be caught again. Okay, that 2-year-old knows what's going on. That 1-year-old is at a stage where they need to have certain factors in place that if they're not, those early life development markers are going to be skewed. Okay, and usually you need at least one protective and buffering caretaker. Some data has shown that if you have at least one of those, these kids can turn out okay. Otherwise, you will lead into long-term disruptions of brain function. Okay, literally brain development function, immune system function, hormonal system function, metabolic pathways and systems and function. And these act through genetic regulatory mechanisms. Okay, that's heavy. Okay, and this is what we call toxic stress response. I'm almost done because this is really big for me. Now, not all stress is bad. There's healthy stress, right? Preparing for a test or getting your kid used to, I don't know, going on a hike, or as they're that stage of rebellion and trying to find their identity at the age of 2.5, 3. You put some rules on there, but so they're not all bad, okay? And but there's a difference, right? When you do that, it's a one-time thing. These are these are brief elevations in stress hormones, heart rate, blood pressure as a response to natural social and environmental stressors. Okay, these are very good. Toxic stress is high dose of adversity experienced during that critical development time. Okay, without adequate buffering and protection of that child to turn to, and it becomes biologically and physiologically embedded, leading to what we call ACE, or toxic stress. Okay, and there's other parts of this. Again, people don't get it. They just say, there's other issues here. Okay, there's other adversities in this society: poverty, racism, discrimination. Imagine a young African-American kid who walks up to some kids at the age of 3, and he's been sheltered with very good upbringing up to that point, happy child, and some kids make a really nasty comment, or a young Hispanic kid. That shit like digs in, right? Whoa, what's going on? This isn't the world I'm being told. And where this attacks is the formation of the self and identity, which is sort of the hub and spoke. It's the hub of all the other attributes of our psychological life that will have problems as these things grow, and it's toxic stress. Now, extents and details are still under investigation, but we do know in general that all of this is true. They do have a very deep correlation with, like I said, immediate pediatric as well as adult, both psychological, behavioral, and physical conditions. Okay, the life expectancy of somebody with 6 or more ACEs is 19 years shorter than somebody with 0. Okay, that's heavy. Okay, and that's somebody that's already had a crappy life and has cost society millions and millions in lost time, and that adverse outcome starts from when they're a baby. As these things go on, failure to thrive as a very young child, growth delays, sleep disruptions, developmental delay. Okay, now you move to a little bit older children that start to get into school age. They have an increased risk of colds and viral infections. Okay, they have increased risk of pneumonia, asthma, lung diseases, okay, atopic diseases such as atopic dermatitis, which is which is an immune response that could eventually become an autoimmune issue. They have difficulties with learning and behavior. Their trajectory of the size of their brain and how it grows starts to fall behind, okay, of the average kid without it. Once they get into adolescence, the shit keeps going. They start to have somatic complaints, okay, headaches, abdominal pain, increased engagement and high-risk behavior, teenage pregnancy, teen paternity, okay, STDs, mental health disorders. This is where the substance abuse comes in, which shows just a small part of all this that you and I play a role in. As adults, diabetes, COPD, cardiovascular disease, cancers, depression, anxiety, again, substance abuse, chronic pain, PTSD, which is really going to be complex PTSD now that we really understand it. I don't know if I said ADHD stuff, but also multiple sclerosis, many other cancers, many autoimmune disorders, which cost over $18 billion a year. Now, when that kid, this is a very cool thing. In fact, I know a young 2-year-old right now doing exactly this. He's a beautiful, marvelous kid and really smart. As shit comes up that doesn't make sense to him, they have to adapt to survive right then and there, okay? They got to do a physiological compensation and adaptation to deal with the psychological compensation and adaptation so they can do a behavioral compensation and adaptation. This is what they do, whether it's neglect, whether it's the mother calling the police for no reason, whether it's the way the mother talks to the father or the father otherwise. And this adaptation, this is crazy, comes at a long-term cost. So this is a kid that's using all of his cognitive machinery, emotional machinery, behavioral machinery to cope with shit right then and there, but he's losing something in the long run. It's not, it's a closed system, okay? And, finally, all of this really reminds me of, for those that are familiar with him, Jean-Paul Sartre, 20th century existentialist thinker and author. His concept of nothingness was an extension of his discussion and evaluation of a concept of human authenticity, okay? And he had this position that we really, and others besides him, French guys otherwise, we go through life acting. There's a Shakespearean tone to this, as if life is nothing but a stage and we go through this world and we're all acting, okay? This is extremely stressful to the system, as the social and environmental and cultural institutions and behavioral modes are built on bullshit, and this is very stressful. Sartre's position was, be authentic. To do that, you need autonomy. You have autonomy. You have free will. But to be authentic in yourself will cause angst or anxiety, which itself is traumatic. And this requires, what Sartre didn't really point to is that, well, a big part of myself that has developed is in fact manufactured by my original interaction with a world that is a stage, some more traumatic than others. And so for me to become authentic and be myself and find meaning in myself, I have to put a lot of stress on a lot of systems in my body, because the overall environment is a stage. And hence, this contributes to the destruction of the ego and the self, which really derives lack of meaning and confidence in that child. And hence, one of the outcomes is substance abuse to cope with that anxiety, depression, pain, feeling of emptiness, and really neurosis, which often people describe it as anxiety and depression. No, it's anxiety, depression, paranoia, and the angst of that, which is 10 times worse than regular anxiety and depression, is what you call neurosis. So this is on the back of my mind with every patient I see.
Yeah, man, that's really well said, doctor. And the part that you're talking about, you say one of the outcomes is addiction. You know, remember I opened up the talk talking about it is impossible to understand, you know, what it is the person, you know, what do they get out of addiction? Why do people keep using something, doing something despite of negative consequences? Here's why. So when I've asked people, you know, in the chair across from me, why do you keep using? They say, well, it helps me quiet my mind so I can sleep at night. It gives me the self-esteem and confidence to walk across the room, look someone in the eye, and shake their hand. It allows me to sit comfortable in my own skin, right? These are some of the things that they share. It takes away my anxiety. So the flip side of that is, why was the person's mind and why was their world so loud to begin with that they needed to seek a substance or a behavior to calm down that voice, that noise, that external noise? Why was their self-esteem so low that they couldn't walk across the room and look at another person in the eye, and they needed that liquid courage to give them that ability to do it? Why was their anxiety so high? You know, why was their social anxiety, their anxiety so high that they needed a substance to bring it down? And you know this, doctor, opiate addicts, you specialize with them. And one of the things that they describe opiates is it's like the warmest hug, or this, they describe it as love. It's like the warmest hug they always wanted, but never gotten. That never got, right? It's this feeling of love that they always wanted, but they never got from their environment. And the reason why these things are so important, man, it's because that whether you look and people talk about the disease model or they talk about the choice model and they want to give people consequences for their choices, both of those models are flawed. And here's why: because they don't look at the environment. Yeah. The disease model centers in the mind of the person. The choice model is the behavior of the person. But human beings, we are life forms. We develop, like Doctor just explained really nicely, we develop in a moment by moment interaction with our environment. That interaction begins from the time we're in the stomach of the mom, right? That's where it starts. That's when we start interacting with the environment. And as we interact with the environment, our brain develops or doesn't develop according to the environment. And therefore substances and certain behaviors and certain certain patterns that we kind of get into, maladaptive ways of coping, become ways of survival, as Doctor was sharing about the 2-year-old that's trying to figure out a way to capping out all of its resources just to survive to the environment that's happening at a rapid speed in a moment by moment interaction. So wonderful said, man. That's really, I couldn't agree more with you. And I look forward to hearing what people have to say on this topic, because I have a feeling if anyone gets on and talks to us, they're going to be able to verify this from their firsthand experience of what they experienced. Yeah,
absolutely. Should we bring Anne on?
Whoever you want. I'm ready for anyone.
There's two. There's Anne and Anna. Are they the same?
I don't know.
I think, I guess so. It's the same. Let's bring Anna. She's on. Anna, are you the...
Oh, hold on. Let me turn one off. Can you hear me?
Yes.
Yeah, you're echoing though, Anna. You might have to turn off your either computer or turn off the other secondary source.
Can you still see her?
Okay, you gotta turn off one of the phones though, like, or something.
Okay.
Can you still see me? No?
Oh, here. Turn off the computer.
Okay, turn off the computer then.
I'm in Orange County, California.
Okay, can you hear me now?
Yes.
Yes, we can.
Okay, I'm just on because I saw you on YouTube and I'm having a very difficult time with benzo withdrawal. I was sent to a detox center and I was also on other medications and they took everything away pretty much. Like I was on morphine and Norcos and all bunch of other stuff and they detoxed me like in 5 days. And I've been suffering like for like a couple years now. I put myself immediately back on my benzo after I got out of detox because I couldn't stand what I was going through. I had metal taste in my mouth. I had the shakes and the shivers and the sweats, and they said they would control all my withdrawals while I was in there, and they talked me into going in there. And now I don't know what to do and where to turn and how to come off of these.
What state do you live in, Anna?
I'm in Michigan.
Oh, and you're just talking about benzos.
Pretty much I'm trying to come off benzos. I really don't have, any addictions to the other stuffs. It's pretty much the benzos that are my main problem. And they are just causing me a nightmare. And I've been trying everything I can. I've been trying to stop them and cut them and taper them. And I've been to hospitals, and all they do is cut it in half, and then they throw me into withdrawal, and then they tell me I'm discharged, and I don't know where to go.
I mean, are you also on opiates? It's not an issue of.
I do take opiates, but not like on a regular basis. It's not like with the benzos, like I have to take them. I'm terrified of withdrawal. I'm already basically in withdrawal while taking them, but I don't want to have like seizures or worse withdrawal. I have dissociation. I have ringing in my ears. I have like so many symptoms. I wrote down like a list, like severe panic and pacing. And
let me, because a couple of things here. This kind of a complex case. Let me ask you one more specific question. Do you want to tell me what benzo you're on and how much?
Currently I am taking Ativan. My brother has been trying to help me out like at night because I've been able to sleep. He's been giving me like Xanax to try and sleep with. But I started out, I wish I had never taken it. It was many years ago, probably about 20. I went to my doctor for pain management. She gave me Flexeril and Prozac. I had a bad reaction to that. Long story short, we settled on Celexa, and then came my first benzo, which was Klonopin. Had I have known now what known then what I know now, I would have never taken the benzo, but it was Klonopin. And that was my long-term one.
Right now, what are you on, and what's the prescribed dose?
Pardon me?
Right now, what benzo are you on, and what is the prescribed dose?
I'm on currently Ativan, which is 3 milligrams 3 times a day. Well, 1 milligram 3 times a day.
Okay, and you also take some Xanax. Okay, look, and you want to come off of benzos? That's what you're saying?
I truly hate them.
Look, we have I think number one, it's for me to give too much advice here, because your case is actually complex. It would be both unethical and unruly of me, because this is it's a complex case. The other issue here is that you're in Michigan. Now, let me ask you one more question. You're a clinician. They don't know, they don't have a plan of because it just kind of smells like this needs to be approached over a long-term method. But also, I don't know your other medications. Everything has to be taken into consideration, including your lifestyle, your mental health issues and all that stuff. Your doctor, I'm presuming, is not familiar with that kind of a detailed approach to this, huh?
No, that's why I wish you were here, but we found out where you're at, because I would have been right at your office trying to get your help, because you seem like you really know how to help me. And I mean, I've tried like the tapering, I've tried stopping it, I've even did the detox. I was currently getting them from my primary care physician, and then they started refusing to do that because of law or whatever. So then they sent me to this place that was supposed to bridge over my meds. She refused to fill my script, and she handed me a paper to go to detox center, which was the worst thing that could have happened to me. I seemed like I was doing good for the first 7 days. They put me on phenobarbital, Suboxone for my opiates. I thought I was only going in there for benzo withdrawal, but they took everything away. And they, like the 7th day, it just started hell and it continued to get worse.
Okay, and here's what we should do, just to help you out in a more kind of a surgical way and get you. So I would call us and maybe next week talk to Nicole. Either one of two things. We have to find somebody out there that knows how to do this, or figure out a way to give you some advice. I think the best way to do this is offline, and give the 800 number a call. Nicole will be there and we'll help you in any way we can. Like I said, because of the state lines issue, I can't really give medical advice, even though it's kind of lax right now in terms of video medicine. But we will do the best we can to lead you in the right way and give you some options. Okay?
Yeah, my husband had already called Nicole. That's how we got connected to this chat.
Oh, great.
The 800 number.
Yeah, she was very helpful.
Yeah, I've been a little bit out of unreachable the last 2-3 weeks because I was on this big major project, but I'm sort of back on now. And this week, and Nicole's here right now, this week I'll address this. I'll talk to Nicole about it, and the two of us will either, she'll probably reach back out to you. If you don't hear from us by Tuesday or something, give her another call and I will do everything in my power to guide you the right way here, okay?
I am in desperate need of help. I can't function. I can't do anything around the house. I tried right after detox, I went into like 3 mental facilities. And all they did was like shift all my meds. I do have thyroid supposed issues, but I think it's related somehow to the benzo. And ever since I got the thyroid med, everything seemed to get worse. And then I'm also on hormone replacement and cholesterol meds. But other than that,
Yeah, it sounds pretty complex. This week we will somehow touch base and really try to do the best I can with the whole team, with tools that we have, given compliance and state lines and resources, to really try and give you guys some meaningful advice so you can start to address this thing. I promise you that, okay?
Any help you could give me, I am totally appreciative.
Okay, you have a deal, okay?
Thank you.
Hang in there, okay?
All right. Thank you so much.
Okay, just hang in there. Parham, you have anything?
No, I'm okay, man. Great job. Thank you, Anna. We'll be in contact, okay?
We'll be in contact this week.
All right. Thank you so much.
Okay, bye, guys.
All right, bye.
Yeah, Parham, these cases are so complex, so many, and it's just, where do you... how do you begin? Where do you begin? How do you find the resources to address all these people's needs? It's just, it's tough. I hope, we'll get a hold of her. Should we bring Frank on?
Yeah.
Hi.
Hi, Frank. How are you?
I'm good. You guys can hear me fine?
Yep.
Yeah.
Okay, good. I don't want to show my face. I'm sorry,
That's
but
cool.
I'm not shy. So I was put on around 10 milligrams of Ambien, and I got highly addicted to it. It has a very, very short half-life. So unfortunately, later in the day, I get crying spells. It has about a 2-hour half-life. I then am also addicted to Phenny, but you haven't spoken about that. It's available online in large amounts. I think the major dose you're supposed to take is like 1.5 grams in Russia, where it is a controlled substance. I'm taking 6 slowly for insomnia. It'd be wonderful if you would touch on water titration with some of these meds, and that you can't do it with every med, so it has to be careful. But one of those options is you can break the medication up and put it in as a suspension in water, and it allows you to take a very, very small increment at a time. That might be a solution for some of these people. So I really don't have a question. I was just wondering if you would ever suggest Valium as a taper from Ambien. That sounds kind of scary. My PDoc is unwilling to do that because the half-life of Valium is about 40 hours and Ambien is 2. So it kind of takes away from the crying spells and stuff like that.
How much Ambien are you on?
12.5, but it's sublingual. And I do have a 10 instant too. You can kind of play games with the control medication by switching between instant and
Yeah.
XR.
Yeah.
Go ahead.
No, on Ambien, actually, the extended releases, if you look at the pharmacokinetics of it,
8 hours.
release is a little bit of a hustle. They're about
Yeah.
about
Curve,
this.
yep.
Yeah, same thing. How long have you been on it?
6 months. I do break it up and take it sublingually. None of the pharmacists go along with that, but there is a profound difference of effect if you take it under the tongue. I saw one study where food cuts it by half. So I'm kind of screwed in a lot of ways on that because I can't ever water titrate it down. And it's so bad that I'm taking small chunks of it in the afternoon. So I clearly don't have crying spells and stuff like that, panic attacks.
Oh, so you're taking it more often than just the night?
A small chunk. So I take like a small chunk on my tongue, 2 o'clock or 5 o'clock to keep crying spells away from it, from me.
Oh, yeah. So
Very sad.
yeah, you're an outlier in that way on the bell curve for Ambien because there is an abuse potential. No, I wouldn't go to Valium.
Okay.
That has a much higher abuse potential. As far as the water thing goes, I don't. There's almost basically it's diluting it down, and you're gonna miss the measurements on that, and there's no need on that. But let me ask you: if you don't take it at night, what happens?
Oh, it's horrific. And my PDoc said there's no withdrawals from it. He's out of his mind. I mean, there's any doctor will tell you. I mean, the nurses, people who are more on the front line will tell you there's severe withdrawals. I would say it's a staccato, if you know music, like a staccato type of sleep. And kind of I'm on fire. And then as well into the next day, if I go cold turkey, I don't know how to describe the withdrawals. It's like the devil invites you to the office and it's a long interview and it's very hot. It's just horrific. So,
again, I don't, I got to get a lot more detail, but in general, no, I wouldn't go to something with a higher abuse potential. What I would do is start playing around with something much less toxic in addition to the ambient 12.5. In fact, what I would do is maybe potentially go to the 10 and then add any one of number of things, maybe Remron, 15 milligrams, 30 milligrams, 45 milligrams, maybe, what's the stuff you can buy, Parham, over the counter, which I'm a big fan of now.
Melatonin?
Yeah, and I would buy a high-grade melatonin, which we're still talking only about a few dollars here, maybe 3 milligrams of that. And first, I would try to see if that would help that. In addition, the other good thing about the Remron is sleep is an off-label use, which it's wonderful for. And even maybe, which I don't like those drugs, but not Seroquel, the other one now. What's the other one now?
Valoric acid?
No.
That's too heavy too.
No. Parham, a lot of addiction kids are either on Seroquel or I'm having a brain fart right now. What's the other one?
Trazodone?
Yeah, trazodone.
Trazodone. It's almost an SSRI and an opiate at the same time.
Yeah. I would try, if I was your doctor, I would play around with any of these, including something like Zyprexa 2.5 milligrams or even super low dose Risperdal. The issue is to have something there that can have a mood regulation component and then start coming off of the Ambien. And, at first I would make it a 10 milligram and demand that you get off the day munching. And then, if you can tolerate it, and if it's going well after exploration, then I would slowly titrate it down to maybe, half of that 10 milligram and so forth. And then eventually that the other drug that you used with an evaluation of the risk benefit and how it's affecting you emotionally, mental health, physically, that should be easier to come off. And that would be my general.
Okay, I'll ask him for a low dose of an antipsychotic. Okay, all right. Thank you so much.
Okay,
Frank, real quick, can I ask a question?
Go ahead. Yeah, sure.
Yeah, you said about 6 months ago you got prescribed on the Ambien.
Mm-hmm.
Was there anything going on 6 months ago that caused you to experience insomnia or having a hard time going to sleep?
Yeah, so it's funny Dr. B mentioned melatonin. And I super outliner on this. It actually gives me manic switching. And that's found there is an antidepressant melatonin based. And I get it the next day. It's very atypical and it causes me to cycle and it gives me insomnia clearly because of it. So I was a big fan of melatonin. It's changed my life in a very negative way. I don't see that on there. I see change in mood, be careful, stuff like that. But I've had almost similar to SSRI, manic switching involved with it. And that gave me chronic insomnia, and that's why I'm here. I know that sounds so strange. It's very rare. Everyone
No,
takes the
it's
melatonin.
serious.
Here, go ahead.
Yeah, no. My question is, but when you were started to take the melatonin for insomnia, I'm assuming that was the first step there. At that point, I'm curious to know your history with inability or
A
having a
job I
hard time
don't
falling
like. I
asleep.
was doing a job I don't like and I hate.
Okay, you still doing the job?
No, I found a better job.
Okay.
But I didn't like that one and I quit that one. Now I'm on a better job. I like
Okay.
intellectual, helping people, stuff like that. And I was making stuff. So I was in the wrong job, repetitively making stuff. So
I
there's
got
a core to it. There's always a core.
Of course, yeah. I was just curious to know, because you sound very intelligent, and I'm curious to know before you went down this line of medicine, what was going on that you seeked it out, in terms of
Horrible,
life
repetitive
skills.
manufacturing job. Not what I'm supposed to do at all.
Yeah, absolutely, man. Yeah, well, thank you for sharing, man. You did a
God bless.
pretty
I
good job.
love both
Much
of your
appreciated.
haircuts. We're doing a little different here.
Frank, before you go, antipsychotic is one of those, but remember, there's also tricyclics. You got to explore this with your doctor, and you seem to be hypersensitive. So tread lightly, start at a low dose. There's tricyclics, there's Remron, and then consider antipsychotics, third generation, or even Risperdal, which is early on, okay?
Okay, yeah, absolutely. I will try. Yeah, a third generation small dose for an atypical one. I don't think I'll try the tricyclicals or any serotogenic stuff.
Okay, all right.
Absolutely.
So good luck. Let us know how it goes.
Absolutely. God bless. You guys have been great. Thanks for taking me so quick.
Bye.
Bye.
Okay, Parham. Let's see. What else? Yeah, this ACEs thing blows me away because some of this stuff seem obvious, right? But it's the subtleties, and one of them you nailed it. The things these kids are supposed to get that they don't get, and the other one that really bothers me is when they use their machinery to deal with that event, and that parent has no idea what the hell's going on. It's not okay to be screaming around him. It's not okay, And by the way, I want to add one more thing, and this might come across as unpopular. The foundational root of what needs to be in place is parents that are together. Once you lose that, shit starts going haywire, and this really and this is so many of us, right? And this really points to the fact that our very impulsive decisions in the first place, and I'm not saying this from a moralistic perspective, right? I'm just saying this from a mature adult's perspective. And it might sound insane in 2021, but if you're going to mess around with somebody and you have enough decision-making capacity to make a child with them, really consider what that means and whose life you're going to affect. That's where it all starts, as far as my thoughts. Let's see. Any questions you want to?
Let me see what we got here.
Wow, there's a lot of chats. I'm gonna go all the I'm gonna go all the way to the top. Oh, Shannon's on there. Misunderstood. Great. She's awesome. Hi, David. Thank you. Hey, Diana. Nice to see you. She's doing great. Any thoughts for Aaron?
So it says, how can I help others that are struggling? I want to one day change careers and help other addicts. That would be a dream of mine. I think Nicole did a couple things in there, but that's kind of where I was at, Aaron. Prior to becoming in my previous life, I was trying to go to university to study political science with the intention and the goal of becoming a lawyer that I never became. I dropped out of college, got kicked out of college at the age of 20. Academic probation, all that kind of stuff like that. They wouldn't take me back. And I didn't go back to school till I was about 25. But here's how I went down this path. I went to a treatment center, and the counselor there was somebody that by the end of my conversation with them, he made me feel for the first time in my life okay with who I was, the decisions I was making, the choices I was making. He kind of like made me feel whole in that moment. And I know that sounds, it might sound odd to say that, but I was so broken that he made me feel okay with being broken. And I left his office that day, and I promised, and I swear to myself, one day I'm going to make another human being feel the way that man made me feel. And then I went on this pursuit. I was about 60 days sober from drugs and alcohol, and I signed up a community college to get my drug and alcohol counseling certificate. My family and friends thought I was crazy to go pursue a drug and alcohol counseling certificate with 60 days of sobriety, not knowing which way is up and which way is down. I followed that into a human services bachelor's degree, and I followed that into a master's degree in marriage and family therapy. So whether it's helping out other human beings that are struggling in the field of addictions, or the beauty of life is we can help out human beings in general, right? You can help out people that are in senior centers. You can help out people that are homeless in the streets. You can help out young kids that don't have mentors and parents in their lives, boys and girls, that kind of stuff like that. There's so much help to do. So thank you for the dream of yours could become a reality, Aaron. I want you to know that. And I hope that you do follow it on, because the world always needs more people that are willing and able to help out other people. It's a really beautiful thing when people do that.
Absolutely. For the TikTok folks, I see, look, guys, I'm old and I'm blind and I can't focus on two things, but I think questions are popping up. Guys, go on the channel, Dr.B Addiction Recovery. Get on there and just ask me the question live, whatever it is. We love talking to you guys. Dr.B Addiction Recovery. All right. Hey, here's one I want to kind of Jack, I pissed hot on kratom and doc stop oxy, started taking more, now want to get off it. Is Suboxone an option? What else can I do? So, Jack, I love the fact that you asked this question, and it caught my eye because the other day I was scanning the literature, and they were talking about potentially using Suboxone for they were having some success. I might have been a case series. I didn't look closely at it. I started laughing because for severe cases of kratom, usually I do tapers. I actually did one on a guy in New Mexico just some time back. But for the severe cases, I do use Suboxone, and I guess the establishment is, it was the most obvious thing to do. I'm laughing because I'm like, I was looking at a paper in PubMed. I'm like, really? Are you kidding me? I started doing that 3-4 years ago for really severe cases. So it is an option, Jack. Get off that stuff. All right. I think older women. Okay. Is Suboxone an opiate? Yes, it is. It's agonist antagonist. Yes, it is an opiate by definition. Okay. Oh, she lives in Canada, Parham. Look.
Okay, awesome. Yeah. Depending on where in Canada, I would suggest looking up Dr. Gabor Mate. Just do it. I think you're going to enjoy his line of work and how he goes about dealing with human beings.
I'm not sure if he's seeing patients anymore. I think he's just basically on the talk track. Do you know?
Yeah, I think he's on the talk track, but he has so much. I mean, he's rooted in Canada, so it's
he is.
Yeah.
Vancouver, I think, is where
yeah
he was at the methadone clinic.
Yeah, downtown Vancouver, and then there's also some organizations up there called Insight and Onsite in Vancouver,
pretty
BC.
awesome.
Yeah, very very awesome in harm reduction.
Hi,
there's Nicole.
You've been hunting me down. Hey, she froze.
She froze. Oh, there she is. Okay.
Hey guys. So, hey, Dr. B, I got a question. Somebody just commented it, but I was going to ask you anyway. Can you tell us, and I really want to know the answer to this because, I mean, I'm an ex-meth addict. Have you, or do you think that that Suboxone helps people that have meth addiction?
Yeah. So, yes, I do. But you know, I don't go around yelling that. In fact, there's some I wouldn't say weak, but there's evidence to support it from data at a certain dose of Suboxone, and I believe that dose is 16 milligrams or higher. It might actually help a little bit with the meth addiction, and it actually makes sense because we are talking about stopping that dopamine rush. And what people don't realize is that all of the stimulants, they work on serotonin or epinephrine and dopamine. And, you know, we always talk about dopamine release with all the opiate addicts, but in reality, these stimulants and the surge of dopamine they cause is 10 times more than any opiate. And so if you're blocking that road, it's very possible that you can potentially, in the right situation, curb off some of the addiction or need for, I wouldn't say, yeah, you could possibly curb off some of, I wouldn't say desire, but some of the effects of the meth so it becomes less enjoyable in the same way that it works for alcohol. So yeah, there's some mild evidence, and I like it when I have the poly substance abuser and they're on 16, 24 milligrams of subs. I think it gives them some relief.
Yeah, I do too. I mean, I've noticed in myself that it has, like, I didn't really notice it at first, but the longer that I've been on Suboxone, the more that I just noticed that it has helped me just with overall my depression, my anxiety, you know, my want to use all substances really. But I just wanted to jump on and ask you that. I also wanted to tell everybody, hey, I'm so glad to see all of you guys in here. There's almost 70 people in here today, and we have been having such an awesome conversation in the comments, and it's you guys's conversation and talking and joining the stream that really makes this what it is. Like, it's super therapeutic and so much fun, and I look forward to being here with you guys every Sunday. So I just want y'all to know that don't ever feel like you're a bother. Don't ever feel like you can't call me. I put the 1-800 number in the chat for a reason, and it's because you can call me. And if I don't get to your call, or for some reason I'm on the other line with somebody else, just leave me a message and call me again, because I'll be there. Okay. And I just wanted to say that I love you guys, and I'll let somebody else jump up here. Okay.
Thanks, Nicole.
Bye guys.
Bye. That's great, because I didn't even make an announcement on TikTok, and there's 50 people there. And again, I keep seeing question marks. You guys should go on here and ask. And I see some great comments. Parham, you see anything? I just want to keep chatting about adverse childhood events, because it's so awesome. Randy, what is she? Randy, did I skip something? Was I supposed to do something with Randy? My bad.
She was the one that also talked about the Coleman Institute over the benzos and stuff like that. She was on a few times. I'm assuming she's waiting for you to call her.
Randy, if I apologize if I forgot something. It's just been crazy. Please let Nicole know, and I will address it this week. I am so sorry.
She did say something later on down the chat that said, Parham, I did it. I was honest with my former therapist. I remember she was saying that she has
yeah.
relationship with her therapist that turned into just a casual conversation.
Yeah. Good. Okay.
And she wrote former, so meaning good for you, Randy. I mean that. That's to take that action despite of fear and to do something that's uncomfortable in the therapeutic process is something that's very, very therapeutic and helpful for you. So I'm proud of you for doing that.
Yeah, I remember. Thank you, Margie. There's so many comments. What the Frank are you talking about?
Yeah, remember, guys, if you're new here and you have a question and you're posting it on the side and we're not getting to it, you can always click on the link that Nicole puts in the chat, and it allows you to come on here and talk to us. Whether you want to put your camera on or off, that's up to you. But we'll do our best to listen to you, and within the boundaries of professional feedback and guidance, considering that we don't have a full history of you, we will do our best to speak in general terms and provide some support. If anything, at least just listen and hear you out and be there for you. So that's the minimum commitment.
She's doing great, huh? Is she on 20 days?
Yeah, 22.
Badass. Let me see if there's anything on. I keep scrolling down. I can't catch it down.
There's just so much.
There's a lot. Let me take a look here. It's too much for me. Parham, what's new over on your side? Anything new and interesting on the other side of town?
On the other side of town, no, man. Still doing what we do. Doing our best to treat human beings like human beings and support them through the challenging time in their life with compassion and unconditional positive regard, man. It's just what we do. So nothing new in us. What's up?
Do you ever get burned out or tired?
I will tell you this, since we are talking about trauma.
Yeah.
So there's something called vicarious trauma, okay? And we can also refer to that as secondhand trauma. And we all know what secondhand smoking is. So if you're sitting next to somebody that's smoking, by default of your physical proximity and closeness to that person, you can also pick up some of the smoke into your body, into your lungs. Now, trauma is the same way for clinicians. So when you're in the field of mental health, if we have any clinicians that are watching this, or if any people are aspiring to be a clinician, as you just learned that many stories are rooted in trauma. So when you sit down with someone and gather their biopsychosocial history and you hear their story about their life, they start to share with you patterns of traumatic events they've experienced. Now, if I sit with that person for 1 hour, for another person for another hour, with another person for another hour, 6 to 8 sessions a day, that's 6 to 8 sessions of possible secondhand vicarious trauma. And over a course of time, right, this thing that Dr. B just referred to as burnout is a psychological, physical, emotional adaptation to that trauma, which starts to drain one's vitality. It starts to make you less creative. It starts to make you less able to take therapeutic, healthy risks. It makes you more resistant to, being present in the present moment. And eventually, the highest rate of burnout exists within the healthcare workers. And we hear social workers, 3 to 5 years, Doc? Is that what they say? The rate of burnout?
Yeah, there's this. And that's and their workload is crazy.
Oh yeah, the caseload is the workload, the amount of people on their caseload that they're responsible for case management, connecting to various resources. It's very high. So if anybody again watching this thing is self-care and boundaries become two of the most important tools that a clinician can use in the healthcare space in order to protect themselves from secondhand vicarious trauma. Show me a clinician that has no boundaries, and I'll show you a clinician that's exhausted. Show me a clinician that doesn't take care of their self-care. What I'm talking about is just the basic stuff. The nutrients they put in their body, the amount of rest they get at night, the oxygen they breathe in, the socialization with loved ones they have. show me someone that doesn't take care of those, and I'll show you someone that's having a really hard time being an effective therapist, counselor, clinician, and they just hop from one place to another thinking the next place is going to be a little bit better, but everywhere you go, there you are. So to answer your question, Doc, I don't currently experience any type of burnout. I have in my career, don't get me wrong. I don't want to sit here and say I've never have. I've learned from those experiences. I used to take on way too much. I used to do way too much. I used to feel responsible for too many. And, by speaking to mentors and learning from people who've been in the field for 20, 30 years and finding out their recipe for success and really diving into self-care, I'm very conscious of what I eat. I'm very conscious of how I live my life. I'm very conscious about the physical activity and all that kind of stuff I do. It's nothing crazy, but it's in moderation, but it's consistent. It's daily. So currently I'm not experiencing burnout, man. I'm really grateful for that. And if I continue doing what I'm doing today, tomorrow, I don't think I'll experience any tomorrow either. And we'll see what happens the day after that.
Everything you said, I agree with. Some of the stuff I learned the same way. Now I'm kind of it's funny you said mentors. I just have to fall to learn on my own, and that's how I learned to put boundaries with patients and work. But let me ask you this: you're also seem to be really strong at time management, and poor time management causes stress. Tell me how you do it so I can pick up some of that.
To be honest with you, I've been like this for a long, long time. This isn't something I learned professionally. As a child, I was terrified of being late. I mean, I can't even tell you in terms of, I have some type of, I don't know if I've done any deep work with it. I have some type of a relationship with time that if I'm not 15 minutes early, whatever the heck I'm doing, I just feel an overwhelming sense of anxiety. And I think some of it came from, I was born in Iran, right? But then I came to the US when I was really young. And then I went back to Iran when I was 9 years old, and I lived there till I was 16. And something about that educational process of going to Iran, not speaking the language, not knowing what you're doing, something about that whole world, it caused a lot of anxiety in me. One of those adaptations was this relationship with time that I have. So I prepare significantly the night before, the day before for the following day. And what I mean by that is if you fail to prepare, then prepare to fail. So every night when I go to sleep, I write down literally everything that I got to get done the next day, the day before, because for as long as I've been alive, after every night, it's been preceded by day. So the next morning when I wake up and the sun's out, it's like, oh shit, it's daytime, right? So I try to get ahead of that the night before, because there's studies and stuff that people that, for example, want to go work out in the morning, if they get up out of bed and go search for their shoes and search for their shorts and search for their socks and search for their shirt, and they can't find any of it, they might go back to bed. But if somebody the night before puts their shoes in their clothes in a gym bag with their towel on top of it and puts it right next to the door, the odds of them waking up and grabbing their gym bag and going to the gym is a heck of a lot higher than a person that's looking for it in the morning. So that same analogy is how I approach my life and my days. I just get ready for it the night before. And that way I'm not struggling through the course of because when the day happens, Doc, and this, it's kind of like trying to change the flat tire of a moving car, especially in your field. You're never going to catch up, man. So when the car is in place, that's when I like to do all the work for it before it starts moving in the morning, because your phone is just like mine. First thing in the morning it starts ringing, it doesn't stop till the end of the night. I can't keep up with it throughout the day, but at nighttime when I get a little quiet time, that's when I prepare.
Yeah, that's good. Before I was in this industry, I absolutely agree with you about that. I like to be 15 minutes early, but as time has gone on here, especially in the last year or so, and some other obligations I have, it's become unmanageable, and working back towards that and all the stuff you said. One of the things I'm doing in the morning now is getting up at 4:30 to do some of the work and get prepared. We got some people. What does the red mean? Misunderstood? Does that
I believe they donated to your.
Thank you so much. That is so sweet of you. Thank you. Wow. We appreciate everything. It keeps us going, and that is very sweet of you. and it means a lot to as you guys know, this is a nonprofit endeavor. Thank you, Misunderstood, and we support you all the way, and stick with us here. Let's get Eric on here. Okay. Hi, Eric. Hello.
You might have your microphone off, Eric. We can't tell. See if you might have to unmute yourself. Oh, nope. Now it just went mute. Let's give it another try.
Give it one more try. Push it again. Eric, I'm gonna. You might wanna, because it's on mute right now, Eric. You gotta push it again. Okay, I'm not gonna take you off. I'm gonna bring you down and try you again in a minute. I'm just gonna go to Ted. Don't go anywhere. We will get you on here. Figure that out. You might have to get off and log back on, but we'll get you on as soon as you're on. Okay, Eric? All right. Let's get Ted on. Ted? Huh.
Ted, nope. Can you hear us, bud? Wonder what's going on.
Ted? Let's try Brittany. Ted, try this again. Hello? I almost heard him. Okay. Let's try Brittany. Brittany.
Hello.
All right, I got one.
Hi.
Hey guys. I was really just listening in today, but I did notice in the YouTube chat that quite a few people were asking, what are some comfort medications or some comfort things to do when coming off Suboxone?
There's Eric. So again, for me, that's difficult to answer because when someone's is this someone that's been on it long term, short term? I myself won't do short term tapers unless if someone really wants. But with if someone's been on it longer, my position is in general that all of these tapers, you should barely feel them, and that's what I strive at. That being said, because to me, any medicine that you're going to use as a comfort medicine for Suboxone, you either came off too fast, and or that medication is more risk than benefit of Suboxone. But all of that said, the only thing, and people will rail and say, hey, you should do this, and this. I just say you need to stay really well hydrated, eat well, and if there's body aches, you really shouldn't have moved down the taper that fast. You could use a little bit of ibuprofen or Tylenol if that's not contraindicated by your physician. And that's my general thoughts on that, because when I do the tapers, a person has to be ready, and it has to be in a way where it's really painless. Does that help, Brittany?
Yeah, I'll tell you this, Doc. Brittany was kind of just watching herself, but the main question was a person named Roberta. Just to give you a little background on this, she didn't say much, but she said she's been on subs for over 10 years and wants to go off. But what comfort meds do you suggest? It's scary, so they're a little scared about getting off after 10 years of use. Just if that helps. I don't know the dose. I don't know the dosage.
Yeah, it does help, and so if you're under a clinician's care, I don't know what dose they're on. And number one, you want to make sure it's time to come off, which I'm sure it is after 10 years. And you've been on it 10 years, and before that, this stuff was you were in a much worse place, I presume. And
12 milligrams. Sorry to cut you off, Doc. 12 milligrams.
Oh, thanks. You're good. No, cut me off. 12 milligrams. Okay. So, this is something you got to work closely with your physician and take your time and do it slow. I mean, I could go through how I go about it if someone's on 12 milligrams 10 years and they're ready to come off. But, it's not something you want to rush through in a month. Anyway, I'm just going to take a shot in the dark, 6 months to even a year. And that's okay because A, your dose is decreasing. So you're achieving that goal that you want. And B, you had 10 years that you've been on it. What's another 6 months to a year? So it's a really, it's a very particular way. I mean, I do my own way of dosing, and the way I do it is I keep very close track of patients and use dose with length of time. As we get lower, they stay on it a little bit longer, and we check to see for withdrawal symptoms and cravings. That I hope that helps.
I'm pretty sure it does.
Okay. All right.
Thank you so much.
Hi, Brittany. Okay, we got Eric again. All right, come on, Eric. We got to hear. Oh, there you go.
There he is.
Hey, Dr. B.
Hi.
First time I'm using this. I saw you on TikTok. That's how it started.
Cool.
But I guess I just celebrated 4 years clean yesterday. I'm a peer support specialist now. A certified peer support specialist. I work with people in the criminal justice system. I guess my question, and it would be kind of probably a long answer. What, in your opinion, what do you think gives somebody their best chances at recovering from addiction? Meaning, like, in the past, when I would go to rehab, I thought it felt like I always had the idea that it was like going to the ER, I'd just go in and I'd get fixed up real quick and I'd get out and I'd be okay. And that was never the case. It was long-term, I got to do this for the rest of my life. So like basically from the moment that you're going into inpatient rehab and on, like, what do you think is the best process that gives you your best chances at recovering?
Nick, I think Parham also has quite a bit to say on this. Parham, do you want me to comment first, or do you?
Yeah, you can go first. I'll go after you. But yeah, I do have some stuff to say here too. So go for it, Doc.
Parham will be great at this as well. So, it's hard for me to answer that because I don't define addiction. We're talking, when we say addiction here, let's just keep it to drugs, right? Yeah, and that person has a problem with that. I don't define it as any boxed categorical thing. There's no, it's such a fluid, dynamic part of that human being's existential reality that's combined with their environment. So, for example, John wants to go into rehab, so he goes into detox. Okay, but maybe that's the first attempt, and it needs 5 more attempts, readiness to change, right? Or maybe on this round, there's many people that whether they don't have the money, the resources, or don't want to, and I sort of assess at that point, well, you can probably do this as an outpatient. I'm doing it with an alcohol person right now. Like, dude, you don't need to go to rehab. I'm gonna. So I think it's where you're at in your mind about what this means, and everybody knows where they're at and how serious they are, and because it's such a entangled web of shit and so difficult to discern all of the components of this crap in your mind. It's hard because everybody wants to get clean, right? I made a TikTok once. Do you actually think John would like to expend every piece of their cognitive and emotional machinery procuring a substance while they lie, cheat, steal, and have 6,000 other things to do? Do you actually think that's a freaking choice? It's not. So given that, right, 2 components. A, it's where you're at. But on the other side, whether it's a professional receptive team you have, or family or friends, they need to always be there ready to catch you and not judge, not enable you, but all the way through. So what I try to do, I deal with a lot of guys that are on the street hardcore, right? Very deep in their addiction. There's a group of patients that I have like that. And with these guys, I actually, when they make their appointments, I have a whole separate, the office has a whole separate ledger for their appointments, because them showing up is 30% showing up, right? But I want them to know, hey, buddy, I'm always here. My team's always here. We're always here. And just keep failing. That's okay. We're not here to judge you shit. If you want to come over here, have a cup of coffee and donut, come on in. So I think it's a dynamic thing, and it's where you're at. Does that help for, and I'm sure Parham has even a better answer, but that's how I feel about it. I'm not that cookie cutter to be able to say, this is what you need. I look at you and figure out if you're living with an abusive boyfriend or girlfriend and who's also using, well, shit, you're going to have a hard time here, right? So it's where you're at, where if you've reached that point, then people know if they're good to go. That's my thoughts. Parham, please enlighten us.
You got it, man. First of all, Eric, congratulations on 4 years clean as of yesterday. That's a big deal. I assume the 4 years prior to these last 4 years were horrible. They're really, really bad. And being a peer specialist or just a helping professional now, it's doing wonders, not just for your own recovery, man, but for the lives of those you're going to touch. For me, I always go back to this. You said, what are like the necessary pieces or elements needed to help somebody, maintain or stay engaged with the recovery process after they start the process? The word recovery, right? This is really important. So the people are in recovery of a substance or an addiction. The word recovery itself, if you look at the word recover, means to regain something that's been lost, stolen, or destroyed, right? So what is it that's been lost, stolen, or destroyed with people with addictions? Usually it's that connection to ourselves, right? So in order to maintain sobriety or recovery, whatever you want to call it, some type of abstinence or just improved mental health, improved quality of life, the most important piece that needs to happen is that reconnection to self. And also, I've heard Dr. B do this on one of his videos, it's also reconnection to society. Especially with the population you're working with, there are so many barriers with them to reintegrate and reconnect back to society because probation, because parole, because, track record, all that kind of stuff like that. So how can we help those individuals feel connected to others, to feel connected to the society they live in? There's studies on this kind of stuff that people that are able to create that connection have a better chance of staying within a certain lifestyle. So that reconnection to self, and what are different ways we can reconnect to ourselves is find out when and where did we lose that connection, right? When and where did I lose myself? When and where did I lose my ability to be within my own body, be within my own self? What did I do to adapt to that, right? And in those adaptations we take. So the answer is usually then and there. It's usually in another previous version of life. And that's what the work that we do in various recovery programs or therapeutic circles is we try to go back to those times that we got disconnected and then get to the reconnection. And then I'm big on a lot of the Eastern stuff too, in regards to connecting this to the body, the mind through body, through things like breathing modalities, through things like meditation, through things like journaling, whatever you want to call it. There's various ways to reconnect with self when we are feeling disconnected. So there is no answer to that that's specific, right? Because case by case, no two thumbprints are the same in the world, nor are two human beings' life stories. However, I do believe that recovery is rooted in connection.
Let me ask, Eric, don't go away. So this was a great, Parham. And, my thoughts on this are this. So you're absolutely right. And okay, if you tell me, I'm going to tell you, and I can intellectualize this and say, dude, trust me, mindfulness and breathing is essential and important in your road to recovery. And I know how to do some of the stuff, and I always advise. But but something somewhere with those individuals, and this is mysterious to me, at what point in their life do they get to that place where they're ready to reconnect? And I think a lot of these guys, issues started so young, they don't know what to connect to. That's a whole, right? Isn't that don't you? And I run into that with some of these kids. One of them, in fact, I was just trying to call. He's up in Seattle, Washington now. And, he's like a kid to my son to me, but that's the other challenge. My own thought on it is keep trying. Eventually it's going to click. And that's why I need to stay there and stay non-judgmental until you get there. Can you give us some feedback on that, Parham?
Yeah, I mean, that's the whole point. It's people get there whenever they get there. Usually when the pain of holding on becomes too much, people tend to let go. However, that letting go moment is case by case. There's another one that says when suffering loses its value, the healing process begins. The greatest clinician in the world, Dr. B, can't come and take away or make you let go of something you don't want to let go to. Same way, Eric, 4 years ago, something happened in your life that you all of a sudden decided to change your ways. But 6 years ago, 8 years ago, if you listen to Parham or Dr. B talk, you say, shit, man, I have nothing. You guys have nothing that I want to hear. It's the teacher appears when the student is ready. All these sayings have been around for a long time. That. Yeah. So it's kind of, as long as the people in the helping field, we stay the same, consistently showing up to people, meeting them where they're at. A good analogy that I have is this, Eric, is our job for you as like a peer specialist that you're trying to get people to engage. And Dr. used that population, the hard street guys that, 30% chance of showing up. It's probably less than that, by the way, Doc.
You're
probably,
right.
Yeah,
I was being generous, 10%.
Yeah, I know you were. Just in case one of them's listening right now or something like that. You're like, hey, at least he didn't throw us under the bus. But my thing is this, as a clinician or peer specialist or whatever capacity you are, or just a friend in recovery, right? Our obligation, imagine a football field, right? Our obligation is to show up to that 50-yard line, right? Not to the 51, not to the 52, show up to the 50-yard line. If they choose to get on the field, they know that we're there for them. The same way Dr. B said, hey, whether you come or don't come, just know that we're there at the 50-yard line waiting for you, right? Some people try to go all the way to the other side and drag them on the field. It doesn't work that way, right? They might be in the locker room. They might be out of the stadium. We just go to the 50 continuously with commitment, showing up to that 50 every single time. Eventually, they come to the 10. They might come to the 20. They might come to the 30. When they come to the 50 and they're ready to be there and meet you where you're at and you meet them where they're at, that's when people are starting to show signs of connection. I'm sure you've had these specific situations in your life that 4 years ago, you started connecting to yourself, connecting to others, connecting to a person, connecting to a group. Something happened that you started to do that. And otherwise, before that, you weren't even on the field, man. So just meet them where they're at.
Yeah. So that's perfect, Parham. And, Eric, one of the things from our perspective, and I've said this a lot before, a couple of things. Addicts are not people you can't force. They're in fact they'll get more pissed off and sensitive if they're, because this itself, if you go back to childhood or as they were coming up, they're, and I've said this on TikTok and I can expand on it now, addicts are a very unique cohort of humanity. They're extra sensitive to the bullshit of the world. That's probably what made them addicts. And in fact, they're very sensitive and aware of, they desire their autonomy and free will. And so you can't tell an addict what to do. And you got to make that clear with them. You guys, I do not give a shit what you do, but I'm here. Please make sure I'm not here to judge you. I don't care. And in that way, that's the 50. Is it 50 yards? I don't know about sports.
Yeah, just the halfway mark. You just show up. You do your part. You show up for your half.
And that's how I hang out there. Eric, you look like a really nice guy. Where are you from?
Milwaukee, Wisconsin. Well, I live in Kenosha, but I work in Milwaukee. I was born and raised here in Wisconsin.
Man, I got to move out there, Parham. People are so much nicer out there. Like
no.
They're genuine down to earth.
Some, yeah.
Hey, did you see the talk we did on Brett Favre? We did a talk about Brett Favre a few weeks ago. Go look it up on Dr. B's YouTube page.
I'll check it out.
Yeah.
I didn't know anything about sports, so Parham had to educate me. That's the quarterback, right?
Yeah, that's the quarter. That was pretty much these guys as quarterback. Yeah, we talked about he opened up about his opioid dependency while he was a football player, and so we kind of utilized that to do a little education on people who use pain medication as prescribed but get caught up with it. Yeah.
Does that help, Eric? Did we help answer that question?
Yeah, absolutely. I kind of already knew that. I like just meeting people where they're at is the big thing, and every time, like, there was a great analogy, I think, because every time I've tried to pull them into the end zone, it just never worked out, and it usually happens when you get more connected with somebody, you have a personal attachment with them, they remind you of yourself, then you kind of go the opposite way and it's not as effective. But yeah, absolutely.
You gotta be really careful. Parham was touching on it earlier. I mean, this work is precious and it's sort of godly, but you have to be cautious, especially given the history of addiction. I implore you to first protect yourself and don't over-invest and you're going to have to learn that. And, you've been doing it some time, I'm sure. Be really cautious, cognizant of it. It is God's work, but if you reach down too far into the mud to pull somebody out, they will pull you in. Never forget that.
Thank you so much, guys.
You got it, bud.
Bye.
Cool. That was great.
Yeah, he's cool. Ted, did we already do Ted?
There was another gentleman who we couldn't hear the audio, so we haven't talked to Ted yet.
Oh, I thought that was Eric. Yeah. Eric was awesome. Ted, can you hear us?
Hey, can you hear me now?
Yep.
Oh, there we go. Okay. Hey, Dr. B and Parham, how you doing?
What's up?
I just had a quick kind of question. I've been on Suboxone for about 7 years now, and in the last few months, I've tapered down to 1 milligram, a little bit less, maybe 0.75, but between 0.75 and 1 milligram. And for reasons I won't go into, basically it's for a job where I need to be clear of all substances. I really have I know it's not advisable. I know how lawyers are supposed to get, but I really have no choice. I kind of have to jump off from 1 milligram. I wish I had more time to do it. I just don't. I do have some help with comfort meds. I have, clonidine and stuff like that. I guess my question is, and again, I know it's not advisable. I'm aware of that it's more difficult to do it that way. Is it doable? Because you read all these stories online and it's like, you're not going to feel normal for months and it's impossible and it's living hell. And it's kind of making it a lot worse. And I recognize that it's kind of messing with me psychology wise, but it's something I kind of have to do it. I have to at least try to do it. And so, it's just one of these things where I'm reading these, horror stories and it's very discouraging because I'm kind of about to go into it and I don't really know what to expect. So.
Sure. Shall I, Parham?
Oh, of course. Yeah.
Can I ask you your age, Ted?
Yeah, so I'm 29 years old.
Okay.
I'm in good shape. I exercise a couple hours a day. I run, lift weights. I'm very healthy that way. It's just this 1 milligram habit.
Sure. Tell me what the initial dose was.
The initial dose. So I was never on about when I first started 7 years ago. I was on 8 milligrams. I never went above 8, and I haven't been on. I've been on 4 milligrams for about the last four months. I haven't been on 8 milligrams in almost a year. So it's been a while since I've been.
How long have you been on the 1 milligram?
About 3, maybe 4 weeks now. So I'm pretty stabilized on the 1 milligram at this point.
Okay. What was your dose right before the 1 milligram?
I went from 2 to 1 just because I knew this was coming up. So I knew I had to drop a little bit quickly. So I went from 2 to 1. I had no problems. I went from basically 4 milligrams to 2 without any problems, and then 2 to 1 without any problems. And now I'm a little bit less than 1, maybe at 0.75 or so.
How much time you got?
I not much. I mean, I have, could, take another dose, I guess, tomorrow. But I'm kind of pushing it, even doing that.
Okay. All right, got it. So in general, I'll give some thoughts that this is not medical advice. All right. By the way, is your job a thinking job, a physical job, a sleeping job? What is it?
Yeah, it's physical. Yeah, physical job. Yeah.
You're not going to put yourself in danger, are you?
No, absolutely not. And to be fair, I've had during this whole period, I have, I foolishly thought I would be able to jump from 2 milligrams. So I have gone a couple nights without taking anything. It was miserable, I have to say. I don't know if it's because I have a high metabolism or what, but I really start to feel it the first night. And so I have experienced my main symptoms are I just have that like inability to sit or lie still. That's really the one thing that I really struggle with. I don't really get nauseous or anything like that. So
okay, all right, yeah, and that's you almost get restless, like, and that's a nightmare. In general, number one, stop reading the internet. Okay, we don't know how things are going to go. Number two, do you know how many times? Forget the internet. Do you know how many times people look at me and what I'm about to do and think I'm absolutely crazy? And I just kind of put on foolish blinders at times and proceed with what I want to do. And it works out. That's pretty much most of my life. So the idea, get it out of your head, right? That it's going to be this way. It's going to be that way. It's going to be easy. It's going to be hard. You seem like a tough guy. You're 29. So just prepare and do it. Make it. You want to reach for the stars, keep your feet on the ground, all right? So prepare yourself with as much critical thinking as possible to minimize adverse outcomes. Number one, drink like a water buffalo. Stay hydrated, okay? Be comfortable with using, if you're okay, Tylenol is great at nights, and I'll tell you why. It hits the temperature regulation in the brainstem. And what people don't understand is keeping temperature down, that's an autonomic response. It's actually soothing. So I'm making a theoretical leap that I've played around with for many years with patients that this will also have some anxiety and calming effect on you. Three, take your clonidine at night, right? In addition to that. Four, keep your body moving, okay? 5, I do recommend some mindfulness meditation. One of the great apps that was just introduced to me by a trainer is called, God, what's it called?
Calm.
No, everyone has Calm, and I've tried them all. And this guy told me, do this one. It's easier than anything. Balance. I've just discovered Balance. It's so easy. It's so amazing. Then I gave it to my nephew, and he's like, wow, this is the best one. And I'm like, dude, that's what I thought. This is the best one I've ever had. Balance. It's just basic. So do all of those things. And if that restlessness is really bad, talk to your doctor. Sometimes you can add some other meds that are kind of wimpy but safe, whether it's Rembrandt, whether it's a touch of baclofen for a short period. And think of it as you have no choice, and you will get through this. I think you'll be okay. You might have to do a little exploring and maybe not, but you should be okay.
Thank you. And I forgot to mention for the restlessness, my doctor did prescribe me Requip or Roquimol.
Yeah, Requip is another one. Yeah.
Yeah. So, I wanted to stay away from the gabapentin route. I've seen your
No,
videos.
don't do GABA.
Yeah, no, I've seen your videos. Yeah, so I'm definitely staying away from that that route. But that's huge. Thank you. I mean, it's just half the battle. I feel like is just kind of realizing you can get through it. And I mean, even if it was, I expected it to be 7 days, 14 days. It's the posts online that are like, you're going to be in this for months that are just so discouraging. And it's 2 weeks. I can easily manage if that's the worst of it. So. That's all.
Yeah, Ted, I will tell you this too, but you seem like you do really well with communicating and speaking and talking about kind of your internal experience. In the same way right now, prior to coming on, you had these questions and you were able to articulate what you needed to say. You were able to hear some feedback. And at the end of it, I just catched that you had a little bit of sense of relief. You know, you sounded a little bit more comfortable with kind of some of the feedback you received and just kind of where your mind was. So as you go through the next 2 weeks, a month, or whatever it is like that, don't underestimate the value of talk therapy or talking to a mental health professional as you're going off it, because sometimes just going there and just talking about some of the symptoms of coming off of something after being on something for 7 years, it does a significant amount of value because, you know, it's all connected, man. The mind and the body are connected. So when you're able to relieve some psychological weight, if you will, the physical body appreciates it as well.
Thank you so much. No, that's awesome to hear. Thank you.
Okay. Good luck, Ted.
Thanks, guys. Take care.
Bye. Hey, Parham, what was the name of the app that I just said?
You just said Balance.
Yeah, Balance. Yeah, guys, Balance is amazing, and I'm kind of going to utilize that with my work. Parham, it's getting pretty late. And this was another lot of fun. Balance, guys. It's called Balance. Any closing thoughts here?
No, man. I mean, this was great. If people are just watching this right now or caught the end of it, please go back to the beginning of this one and watch it from the beginning, because we did dive into the root causes of addiction from our personal and professional perspectives. It's something that we both really believe in and both stand strong in that stance. So if you appreciate the things we say, if you like the way we look at addiction, if you like the way we treat human beings, it's because our theoretical framework comes from the stuff we shared about earlier today.
Yeah, yeah, absolutely. And to Paul, who had asked about that, I don't know if he's here today, but I hope he sees this. Parham, I just want to remind everybody, I'm looking at talking to Parham about changing the Sunday to a different day. So I'm just letting all you guys out there know. I'm going to talk to Parham about it. Again, we've been sticking to it. We missed once. It was on me. But the only thing I'm considering doing is switching the day to get some work done today. Again, thank you guys for joining us on TikTok this week. You shall see. In fact, our production guy for all of this is flying out from the East Coast, demanding I make new TikToks. I've been so busy, but go on there, like, subscribe, join us there. Thank you guys for coming on. YouTube people, we love you. We thank you. Again, this is you guys' show. Still more of you need to come on. I know you get this lively chats generated on the side. And what are we doing next time, Parham?
Hopefully I want to do the Anthony Bourdain one.
I do too.
I do too. Let's just do it just for our own sake. If people get a lot out of it.
Yeah, you're right, because I have a lot to talk about. That was a guy with true existential angst, right?
Yeah.
From day one. I mean, you're looking at this guy and you're like, dude, this guy knows it's all bullshit. And that's why he was doing the blow early on. Yeah, I have a lot of respect for him. Yeah, we can do that. And just so you guys know, there might be a switch where we go and next Sunday it doesn't happen, and it'll happen in the midweek. I'm going to talk to Parham. Thank you very much. Let me say bye to TikTok guys. You guys are awesome. Join us on YouTube. I'll see you guys this week, and I'll look at your comments that I haven't looked at in a few weeks. I miss you all. Bye, guys.
Bye, everyone.
Let me say bye to these guys. Bye, guys. Thank you all. Watch it if you didn't see it, and come on. And Nicole, thank you so much. Bye-bye.